All, this is Dr. Mobeen Sayed with one more episode of Long Story Short from the FLCCC platform. The discussion that I want to do today is about magnesium. Magnesium has been used in emergency departments intravenous or orally for cardiac arrhythmia patients for a long time. Similarly for muscle relaxation as well. Similarly for GIT issues too. However, today's context in which I want to look at magnesium with you is the long COVID and vaccine injury, especially neuroprotection and muscle protection. So the patients with the muscle fatigues or tiredness, muscle pains, I think they would benefit from this discussion. And magnesium is part of the FLCCC protocol as well. So let's start. So first of all, a quick look at the references. So this is FLCCC. So you can go to flccc.net or COVID19criticalcare.com. Here, if you go to the top, this is the treatment protocol. And then in there, I would open up this I-RECOVER-Post-Vaccine here. And if you see, I'm just very quickly going to go over. I'm doing this in front of you so that you can do a similar thing to find out about magnesium within the protocol. So if you search for it, summary of suggested therapies, and here if you see adjunctive second-line therapies, magnesium 100 to 400 milligram daily. And Dr. Paul Marik has done a great job of actually pulling together various kinds of magnesiums and what is more appropriate. So if you go into this magnesium section, here if you see magnesium 100 to 400 milligram daily, there are at least 11 different types of magnesium that can be taken in supplement form with varying bioavailability. Generally, organic salts of magnesium have a higher solubility than inorganic salts and have greater bioavailability. So if you see here, magnesium citrate is a widely used type of magnesium in salt form and is often recommended to treat constipation. High doses may cause diarrhea and prolonged use should be avoided. Then magnesium oxide, magnesium citrate. He then talks about the magnesium taurate, malate, glycinate, and L-threonate have good bioavailability. So I would recommend that you look at that as well. Look at the dose too. A starting dose of 100 to 200 milligram daily is suggested, increasing the dose as tolerated up to 300 milligram females to 400 milligram daily. Endpoint of treatment includes an RBC magnesium at the higher end of the normal range between 4.2 and 6.8 milligram per deciliter to be about 6 nanogram per deciliter. High intake of magnesium from dietary supplements and medications can cause diarrhea, nausea, and abdominal cramping. By the way, I take magnesium daily as well, and I do not have any of those. I take it within the recommended dosage. So then if you look at the cardiac issues area, here is something with the homocysteine levels. These patients are also those who have elevated homocysteine levels. They are also recommended to have magnesium. Then here in the myocarditis, pericarditis, magnesium to reduce the risk of serious arrhythmias, and the dosing as has been shown above. So this is in the FLCCC. The dosing that I will present to you is actually in alignment with this. However, I picked it up from the studies so that I stayed loyal to those studies and do not editorialize what the studies are saying. So here is your basic information about the protocol and magnesium present in there. Now, just a quick glance. This is a page from Journal of Emergency Nursing, 1996. The point of showing this is that magnesium has been in use for a long time. So if you see here, magnesium is an important ion. Many ED patient, emergency department patients, may be at risk of hypomagnesemia. Intravenous magnesium sulfate has been proven to be effective in the treatment of various dysrhythmias, and there is sufficient support for its use in myocardial infarction, preeclampsia, eclampsia, and warrant the attention of emergency nurses. So very quickly, I'm going to show you these studies and then just the links to them. These links are all present with this video as well. And then I'm going to just go in a discussion of these studies. Again, the context for me today is magnesium and long COVID and vaccine injury. So here, right at the top, I have put this from the Goodman-Gilman. So this is Goodman-Gilman. This is supposed to be the god of pharmacology. So in here they say, for example, an order of administration of magnesium sulfate must not be abbreviated as MS, as this may result in administration of morphine sulfate. So just a quick note to the providers that don't abbreviate. Plus, when you are writing for the magnesium, it will be useful to write the diagnosis for which magnesium is used. Okay, continuing. So I have no financial disclosures. Magnesium now generally is looked at as an anti-inflammatory. Do you know how it is anti-inflammatory? The innate arm of the immune system, which nowadays we have become all very much aware that there is an innate arm and there is an acquired arm. Magnesium causes T cell activation. It actually helps modulate the macrophages function and neutrophils function. So it is a big modulator and activator of the innate arm. It is a very important ion for the innate arm's proper function. So there are some studies that say it is useful in asthma because it causes smooth muscle relaxation. So this smooth muscle relaxation, I would like you to keep this in mind throughout this discussion, because at the end of the day, with the vaccine injury or the long COVID, if there is an endothelial problem, a vascular problem, then smooth muscles are present in vessels as well. And the smooth muscle relaxation will help dilate the blood vessels, and that would bring more blood flow. This is an important part. So bronchial smooth muscle relaxant, for example, found useful in asthma. There are some studies that say it is no use, and there are some studies that show that it is useful. Then it is an essential nutrient, magnesium, and it is involved in about 600 or more than 600 enzymatic actions in our body. This is why today I want to keep our context in the long COVID and vaccine injury, because if I started talking about every single enzymatic action, and if I did one lecture every day about it, it would take me 600 days, 2 years or more, if I work every day. So about 600 enzyme actions need magnesium as their cofactor or be present to work. Then it maintains muscle integrity. So this is an important part. I want to show you the study. This is what is important to understand for long COVID and vaccine injury, especially muscle fatigues and muscle pains and muscle inflammations. Then it helps protect neurons from overexcitation and death. I would discuss this as well. The basic idea is that when magnesium is present in appropriate amounts, the levels are correct, then magnesium prevents, especially the glutamatergic neurons in our brain, neurons that are responding to glutamate. It protects them from overexcitation. And a neuron that is overexcited, that is working beyond its means, will actually cause apoptosis and die. And magnesium's presence causes the neuron to function optimally and not overheat, if you will, like a car's engine, and not cause apoptosis and die. So it is neuroprotective. And this is called excitatotoxicity, where the neuron is too much excited. This is like if you sit down and you just rev the car's engine to a point that it just breaks down. So magnesium protects from that. And then, of course, heart, muscle, and arrhythmias. This is the use that has, as I showed you, for decades it's been used. Now, the dosage in these studies that have been recommended. I have already shown you the recommended dosage with FLCCC. So 14 to 18 years, 360 milligram females, 410 milligram males. 19 to 30 years, 310, 400, 31 plus year, 320 to 420. So adequate magnesium levels have been associated with lower mortality rates in COVID-19 patients. I'll show you this study in a second, and less severe symptoms. And where is it found naturally? Of course, you can Google it and you can search it, and there are many, many resources that can show you. But generally, avocado, spinach, almonds, pumpkin seeds, whole grains, black beans, wheat, oatmeal, these contain magnesium. And of course, magnesium supplements. Then I hope that we know that magnesium has a huge role in vitamin D activation. And here is a very delicate point that I would like us to take away. Even if vitamin D is present in the correct levels, in the correct amount in our body, so you do a check of the vitamin D level in a patient's blood and the levels are correct. However, if magnesium is low, then the appropriate amounts of vitamin D will not become activated. So it will act, the vitamin D will act as if it is deficient. So magnesium levels and correct levels are important for the correct behavior or activation of vitamin D as well. This is a very important point to keep in mind. So mechanism of action. There are many mechanisms of actions. I'm going to take this one. So this study is linked in the description. the role of magnesium in neurological disorders. So if you see here, imagine where my mouse is. This is the inside of the neuron, and this side is the outside of the neuron, and this is the neuron cell membrane. In there is this channel. This is a glutamate channel. That means if you see here, when the glutamate acts on this channel, that causes calcium and sodium to come in and potassium to go out. There's a counter transporter. But if you see here in the middle, there is this magnesium present. So magnesium kind of blocks this channel. So you could say that what is the benefit of a channel that has a magnesium blocking it? So what happens is, imagine if a neuron has 1,000 of these channels in, let's say, 1 centimeter area. And then we have the correct amount of magnesium available. That would mean, maybe, I'm making up a number now, maybe 70% of the channels will be blocked by magnesium and 30% will not be, and those will be functioning, and that gives an optimal activity to the neuron. On the other hand, if the magnesium is depleted, then there are less magnesiums blocking these channels, and now instead of 70% channels not opening, let's say 50% are not opening and 50% are opening, and that would cause more excitation and more work for the neuron. Now remember, when the neuron or any cell is working more, it needs more nutrition and it produces more waste products. And if you keep revving the engine, that cell, if it is not properly cared for by proper blood flow and by proper waste removal, then that neuron would die under stress. So magnesium protects for that. So this is this study, the role of magnesium in neurological disorders. So here, now I'm going to go over these studies that I showed you one by one to show you again in the context of long COVID and vaccine injury and even acute COVID. So here, first study, higher intake of dietary magnesium is inversely associated with COVID-19 severity and symptoms in hospitalized patients, a cross-sectional study. So in this study, if you see here, the diagram is from the study, the magnesium, when present, it helps bronchial smooth muscles to relax, which would be useful during the acute infection. It acts as a cofactor to produce adenosine triphosphate, ATP, energy. Now what happens is, whenever our body is under stress, we are working more and then we need more energy. And if we are not producing more energy, then our cells would start dying. The same thing, they would go under stress. They would not have energy to work, but they would be asked to work, and eventually they'll just commit suicide or they'll do apoptosis. So magnesium's presence would help continue to produce more energy fast enough. If you see on the other side here, improved immune system, so regulating the vitamin D activation, activating the T cells, and then orchestrating immune cells, macrophages, neutrophils, and others. So that all balance produced by magnesium, especially the partnership with vitamin D and partnership with smooth muscles in the blood vessels and in respiratory system to relax them, is a hugely important factor to help with the acute and long COVID. So higher intake of dietary magnesium is inversely associated with COVID-19 severity and symptoms in hospitalized patients, a cross-sectional study. So if you see here, they're talking about, we propose, so this is the relevance of magnesium homeostasis in COVID-19. They say, we propose to consider the relevance of magnesium frequently overlooked in clinical practice. It is therefore relevant to include magnesium in the ionogram to diagnose alterations of magnesium homeostasis, which might represent one of the many dowels that contribute to complete the complex mosaic of signs and symptoms of acute and long COVID. Monitoring and restoring magnesium homeostasis through an appropriate nutritional regimen or eventually by supplementation should therefore be taken in account for a general population, in particular during the current pandemic, as magnesium might contribute to prevent SARS-CoV-2 infection, to reduce severity of COVID-19 symptoms, and to facilitate recovery after the acute phase. I have actually heard from many long COVID or vaccine injury patients with muscle pains and muscle fatigues that magnesium, zinc, and CoQ10 have been very helpful, these three. Of course, near-infrared light, methylene blue are, I believe, additional things to keep in mind. Now, another opinion article, can maintaining optimal magnesium balance reduce the disease severity of COVID-19 patients? There is a strong evidence of magnesium playing a role in reducing the severity of asthma symptoms. Magnesium has been shown to exert anti-inflammatory effects, adequate magnesium levels have been associated with lower mortality rates in COVID-19 patients. So we have seen this one before. Magnesium role in activating vitamin D is essential in that vitamin D has been shown to reduce the rate of viral infection in patients with several respiratory tract infections. And I want to show you something a little deeper in this study. So in this study, they have a number of graphs or charts for magnesium. So I want to show you this one. So tertiles of magnesium intake. So what they did was hospitalized patients, they asked them questions for what kind of a food are they eating and how much. And based on that, they created the levels of magnesium that they are taking. Of course, they looked at their vitamin B12 and other nutrients as well, but magnesium too. Based on the magnesium taken, they divided the patients into low magnesium, moderate, and then appropriate amounts. And what they found was that patients with lower magnesium levels, these patients actually had more severe outcomes plus had more symptoms as well. So let's look at these. And there was some question when I presented this before as well. There were questions that if you see here, there are many things that they were measuring. Of course, if you ask me that, hey, what did I eat? My food would contain a lot of supplements or a lot of nutrients. So they looked at the energy intake, carbohydrates or energy production, calories eaten, carbohydrates, fat, protein, diet, vitamin B1, B2, B3, folate, vitamin C, etc., zinc, potassium, and magnesium. And they, based on this, they divided them into three tertiles or three groups, low, medium, and high. And high being the appropriate levels. And it turned out that if you see here, this is a low magnesium intake, milligram per day, 278. This is more towards the normal-ish, right? So 370, 80 to 420. So this is more normal-ish. So those patients who were on the lower side of magnesium were not doing better in terms of severity and symptoms. So some listeners had said that, hey, there were other things too. And maybe these were the other components that were helping. So of course, all of these help. This is why these things are part of our food. However, if you look at their levels, I actually did double checking, but spot checking, not all of them. And the ones that I checked, they were from the lower to the higher, they were still within their normal ranges. So magnesium was the one that was in the abnormal range. So I would recommend that you check that out as well. So they did this study, and here is what they found. I believe this is the important takeaway for today. They found that the C-reactive protein, which can be used as an inflammatory marker, it is produced during the acute inflammations, and the erythrocyte sedimentation rate, which is an indicator of a long-term inflammation or long-term chronic diseases. And if you see here, low tertiles of the magnesium had C-reactive protein and ESRs high, while the normal ranges of magnesium actually were associated with, and this is a p-value significant, with lower levels of CRP and ESR. This is a very important chart. So I wanted to share this one with you. Then if I go to this one, the second study, let's actually go back to our presentation. Then in this study, impact of magnesium supplementation in muscle damage of professional cyclists competing in a stage race. This is a very interesting one. And this is why I wanted to present this particular talk. Muscle aches, fatigues, muscle pains, especially in long COVID and vaccine injuries, of course in ME/CFS as well, or other reasons for inflammatory muscle problems. In this study, what they did was they took 18 bicyclists, divided them into 9 and 9 groups, so small study. One group was given magnesium and one group was not. So 400 milligram per day of magnesium during the 3 weeks of competition. And then what they did was they checked their levels, the tissue markers. So of course, when the bicyclists would, do that rigorous exercise and compete, their muscles will be active and the muscles will break down during that time as well. And there will be some damage that would occur. And then that would be recovered. It's not a permanent damage, but still that would happen. So what they found was the levels of serum and erythrocyte magnesium, lactate dehydrogenase, creatinine kinase, aspartate transaminase, alanine transaminase, myoglobin, aldolase, total proteins, cortisol, and creatinine were determined. So they took a bunch of markers from their blood while these bicyclists were competing. Serum and erythrocyte magnesium levels decreased during the race. This is a very important thing to note. That it is not that if I took magnesium today, then the whole day my magnesium is going to stay fine. If I am fighting with an infection or if I'm working, my magnesium is going to get used up and I'll need magnesium again. So as the bicyclists were competing, their magnesium levels would start dropping because magnesium is used up. Circulating tissue markers increased at the end of the race in both groups. Makes sense because they are both competing and they're both exercising vigorously. So their tissue markers, tissue breakdown markers have increased. However, myoglobin increase was mitigated in the supplemental group compared with the controls. So those who were taking magnesium, myoglobin, myo means muscle, globin is a protein inside the muscle. So this is a protein that participates in the muscle structure and muscle function. That protein was spilling out as the muscle cells would break down, but it was not doing that much in those who were taking magnesium. This also means long COVID vaccine injury, if someone has muscle pains and muscle inflammation, and if they're taking magnesium, this can really help them, potentially help them. We conclude that magnesium supplementation seems to exert a protective effect on muscle damage. So the role of magnesium in neurological disorders. So here, as I had shown their diagram already before, I just want to make us aware that excitotoxicity, excessive excitation leading to cell death. This happens for all of our cells. If our cells are overstretched, meaning overexerted, overexcited, and if they cannot get enough energy produced or enough waste products removed, these cells decide that they have severe shock or severe stress. And one way to cope with the stress is to just die. And the cells would start killing themselves. So in this study, what they did was, they were neurons under stress, but they were given magnesium. And the neuron will not become overexcited. And it will protect the neuron from apoptosis. So this is that study. I would recommend that you look at it. I took this diagram from the study as well. So thanks to the authors. Beautifully done study. So moving on, if I go back for a second, look at this. In this study, they talked about migraines, chronic pain, epilepsy, Alzheimer's, Parkinson's, stroke, depression, anxiety. Molecular studies and animal studies have shown neuronal protection from pre-treatment, meaning somebody who's taking magnesium daily. Here, pre-treatment is that before you put the cells under stress, you treat them with magnesium. With magnesium, making this mineral of intense interest for its potential neuroprotective role in humans. And so this is my second point for today, that those patients of long COVID or vaccine injury that may have neurological symptoms, they should check their magnesium levels and with their doctor's advice should add that. So then here, fibromyalgia was initially considered a rheumatic disorder. This is the same study, but is now known to be a neurological condition with intense, widespread pain and tenderness coupled with other unpleasant symptoms such as severe fatigue, cognitive dysfunction, memory loss, headache, and sleep problems. So when they administered magnesium, erythrocytes and intracellular muscle magnesium levels are decreased in fibromyalgia patients, while there has been evidence that plasma and serum levels remain in normal range. This is very important, that it may be that the magnesium levels in the blood are normal, but getting in the cell and being in the cell, magnesium may be less there. However, other studies have shown significantly decreased magnesium serum levels as well in fibromyalgia. So based on these findings and studies, a recent study examined the effects of 300 mg magnesium citrate and 10 mg of amitriptyline alone and in combination in 60 women with fibromyalgia and 20 age and sex match controls over 8 weeks. Both erythrocyte and serum magnesium levels were significantly lower in the fibromyalgia group. Furthermore, the group receiving the combination of magnesium and amitriptyline reported significantly decreased pain and improvement in the number of tender points and intensity of fibromyalgia pain. And I understand that this pain people can be tired and achy even while they are resting. And so if a simple thing as magnesium can help ME/CFS, fibromyalgia, long COVID, vaccine injury, I think it's a big benefit. So it's not just a muscular issue, it is also a neurological issue, and magnesium actually helps in both of those areas. Then magnesium relaxes arterial smooth muscles by decreasing intracellular calcium without changing intracellular magnesium. So what happens is that the smooth muscles, or other muscles too, but let's stay within the context of smooth muscle. What happens is that smooth muscles, when they have to contract, what they do is they open up channels through which calcium comes in. Smooth muscles internally also have stores of the calcium. They use the calcium for muscle contraction. So what happens is magnesium actually reduces that contraction of the smooth muscles by decreasing intracellular calcium without changing intracellular magnesium. So magnesium is present inside the cell and doing its functions because it is participating in 600 type of actions. However, it reduces the input of calcium coming into the cell. That causes the cell to not contract that aggressively. And that is a smooth muscle relaxing mechanism, which in turn will cause, for example, bronchial smooth muscles to be relaxed or blood vessel smooth muscles to be relaxed. And one of the challenge of long COVID and vaccine injury is that sometimes blood flow is impacted because of vasoconstriction. So magnesium can help with that. Of course, that also means that somebody who's hypotensive, they should talk with their doctor to make sure that magnesium would not cause so much relaxation that now they are getting dizzy or they are at risk. So just discuss with your doctor. Then elevation of brain magnesium prevents synaptic loss and reverses cognitive deficit in Alzheimer's disease. So here, this is another study which shows that when brain has appropriate levels of magnesium available, then the cognitive deficit in Alzheimer's pathology is reduced. It is actually a beautiful thing. If you read their conclusion, our results suggest that elevation of brain magnesium exerts substantial synaptoprotective effects in mouse model of Alzheimer's disease. Synaptoprotective is where one neuron finishes and the other neuron starts. Between these two neurons, there is a gap through which the electrical activity of one neuron gets translated into chemical activity, so neurotransmitter, which then goes to the next neuron, and then the next neuron becomes excited or inhibited. So this is called the synapse, that little gap. And magnesium protects the synaptic activity. Then magnesium and cardiac arrhythmias, I think that most of you already are aware of it. I just wanted to put that here for completion's sake. Oral magnesium has been used for many years in patients with symptomatic extrasystoles, that is extra beats in the heart. Studies show that the incidence of extrasystoles as well as patients' symptoms are reduced during oral magnesium therapy. And so here are the references, and thank you very much for being here. Once again, the takeaway, it would be best if you can actually get your magnesium levels checked. And then it will be amazing if you can speak with your doctor and make sure that your magnesium levels are good. There are various kinds of magnesium. Some magnesiums can cross blood-brain barrier, some preparations, and they can go to brain, some cannot. So Dr. Paul Maddox, the protocol, magnesium section in that protocol, please check that out to see which kind of magnesiums are interesting for various kinds of outcomes needed. So with this, thank you very much. I would see you again. Bye for now.